welcome to the podcast. Today we're going to talk about insurance liability, and what more appropriate setting can we have than a pandemic and all kinds of issues of returning to play and coming back to campus. I'm so pleased to have my guest as Richard Giller. He is a partner in the Insurance Recovery and Advisory Group with the global law firm Pillsbury, Winthrop, Shaw, Pittman, and he works out of the firm's Los Angeles office. Richard is one of the only lawyers in the country with a significant breadth of experience representing professional athletes, sports teams, and leagues regarding a myriad of insurance claims and issues. He's a thought leader in this unique area of sports law, and he's routinely interviewed, frequently quoted, and has served as a guest lecturer and a featured presenter at a lot of universities, webinars, and national conferences on these topics. And that's how I met him. So Richard, welcome to the podcast.
Well, thanks for having me, Karen, and that's a pretty good introduction. Hopefully I can live up to the hype.
Well, I saw you over a webinar with Donna Shalala and Tom McMillan. So I think if you can hold your own with them, you're going to do just fine here.
I appreciate that. Looking forward to it.
So give us a sense for what kind of risks NCAA institutions should expect in their return to play modes these next couple months.
Well, at the webinar, we talked about the insurance issues arising out of canceling March Madness and professional sports teams suspending and canceling their seasons and the starts of seasons. But the reopening of sports, both professionally and collegiately, presents some interesting legal issues, insurance issues, and issues that other businesses are also facing. So, the question arises is, how do you reopen the academic portion and the sports portion of college, the college experience, and still protecting the universities and colleges from liability? I think we talked about in the webinar, the overriding factor here is going to be there will be lawsuits. There will be lawsuits no matter what a college or university does. They're going to get sued for some COVID-related claims and issues. So with that as a backdrop, you need to understand, how best to try and minimize the exposure. Being sued is one thing. Having to pay settlements, claims, or judgments is something different altogether.
So knowing that going forward, let's start with a basic question. Can a university or an athletic department be sued for not cleaning their facility up to standards or for someone not wearing a mask?
Okay, so great questions, Karen. The theme I just talked about is still true. They can be sued for any of that. Whether they have liability is another question. So the colleges and universities will have the same duty of care that any other business would have. And so if you breach that duty of care, if you fail to follow procedures and guidelines that you implement for trying to protect students and student athletes and fans from, the COVID-19 disease, then you might have liability. But, the bottom line is either the NCAA or conferences or the schools themselves should come up with some sort of, comprehensive guideline that lays out all of the, plans that they have to try and keep everybody as safe and as healthy as possible. And those plans and guidelines will be different for, 100,000 seat football stadium than they would be for classrooms and dormitories, but, they are very similar. So if you come up with a guideline and a set of plans that are consistent with either the CDC guidelines or federal, state, and local health regulations, and you follow those as much as humanly possible, you will then minimize the risk of liability for the claims that are sure to come.
Right. So at this point, the NCAA is starting to come up with some guidelines, and some conferences are in active discussions about those guidelines. But the American College Health Association came up with a robust set of guidelines. I don't know if you've had a chance to see them, but they're the ones who've dealt actually the most with college athletics.
I haven't seen those, but I have seen recently the television and motion picture industry, which is big where I am, came up with a 22-page white paper that lays out, incredible guidelines and guidance and rules and regulations that they believe production companies and studios should follow when they resume film production and TV productions. And they could be used as a sort of a guidepost for college athletics as well, because some of the things you have in the entertainment industry, which I deal with a lot as well, you have props and you have wigs and you have things that are going to be touched by people all the time, and the cleansing and cleaning procedures implemented are going to be important. Cleaning the helmets. One thought process is, does Oakley come up with a new face shield for football helmets that doesn't just cover the top half of the helmet and but actually extends down below the face mask? There are all sorts of issues, and then that could create liability issues if it breaks off and somebody gets injured by a piece of
Right.
face mask. You can only do so much. You're not going to be able to protect every single person from exposure to COVID-19. And there's an interesting distinction, and not very many people pick up on this, but the virus is actually designated as SARS-CoV-2. The disease that comes from SARS-CoV-2 is COVID-19. And that stands for coronavirus disease 2019. So COVID-19 comes from that. And protecting exposure to the disease is what colleges and universities are going to be worried about when they return to sports. And professional teams will have the same issues and procedures and guidelines that they're worried about too.
What are some best practices that schools could use to demonstrate that they are adequately cleaning and providing personal protective equipment?
Well, I think some sort of check-in, check-out system is probably a good idea. When you hand out masks to every athlete, you should have them sign something or an electronic signature that says I've received it that day, I turned it back in. The non-washable masks should be disposed of every day. The washable masks should be washed every day, and keeping track of who's receiving them, how they're being cleaned or disposed of, will go a long way towards minimizing liability down the road.
Yeah, that makes a lot of sense. Just documenting, and being sure that you're conscious of doing that.
Oh, absolutely. And also, whenever you have the guidelines, make sure everybody involved in the guidelines has a full copy of them. Hand them to every athlete, whether electronically or paper. Electronically is probably better. And again, have an email to an athlete and fans that says, here are our guidelines. Please check the box that you've received and reviewed and read them, and keep track of all of that as well.
Right. So shifting gears, looking at the student athlete, if they should contract COVID as outside of the practice facility, let's say they think they got it in the residence halls, are they then treated as an athlete or a student in the eyes of the university?
So you raise a couple of really interesting points with that question. First of all, causation is going to be an important issue in any lawsuit that arises out of any fan or student athlete alleging they contracted COVID-19. So how do you establish that? If I've seen a couple of plans for universities where they're going to have 25 or 50% capacity in their stadiums, trying to observe the 6-foot social distancing, making sure everybody wears masks. And if someone ends up attending a game and then tests positive for COVID-19, how do you prove that it happened at the game or at the tailgate party, if they're even allowed? Or did it happen at your local grocery store or drugstore, or did you attend a family event where somebody contracted COVID-19? So the causation issues are going to be important if and when lawsuits arise. But to your question on whether you're treated as a student or a student athlete, I'm not sure the distinction is going to be important in terms of liability. Coaches and athletic department and their staff can only do so much with what happens to a student athlete outside of the practice facility or the field or the arena. They can try. It's very similar to how hard coaches try to monitor and have some control over social networking. They're 18, 19, 20-year-old kids, and they're going to probably engage in activity that could, you know, expose them to COVID-19 because they're not, you know, doing social distancing or employing all the hygiene tactics that the guidelines will establish. So I think they'll be treated as a student or a student athlete, but contract tracing is going to be important to determine how you actually, you know, potentially contracted the disease. And then that raises all sorts of privacy issues, you know, temperature checking when you come into a weight room or you know, practice facility, and self quarantine when you have any symptoms. The issues are, you know, far reaching, and trying to do what's best for the athlete and the student, keeping that in the forefront of your mind, you know, at all times will go a long way towards helping.
Yeah, makes sense. So it's important to realize that just because they're an athlete, they may not get special dispensation because they're viewed as a student on that campus.
Correct. Although, you know, the student athlete may get tested more often. They
Right.
should probably be tested more often, especially in contact sports where you are, you know, sweat is being expelled and spit and, you know, bodily fluids coming all over the place. In those situations, you're going to have to be tested more regularly. I've heard some people complain, why should a student athlete be tested more often than the student body? But it's because they are potentially engaging in more hazardous, you know, activities, and the exchange of bodily fluids somehow,
Yeah,
you know, makes it a potential more likely event than a regular student just walking to class.
absolutely. So on the webinar, you talked a little bit about this business of assumption of risk, the established duty of care, and you compared it to what baseball tickets have on the back with kind of like, you know, you might get hit by a foul ball, so be aware. Can you explain that to us?
Sure. And this happens in ski resorts and all sorts of athletic endeavors where, you know, the ski lift ticket says you assume all the risks associated with, and you understand the risks associated with skiing. The same thing with a fan attending a football game, you know, or a baseball game. If you buy a ticket to a baseball game and you're in the first 5 rows down the left field or right field lines and you get hit by a foul ball, you may sue the club because you may claim that they didn't, you know, uphold their standard of care. But the defense to that lawsuit, one of the defenses, is assumption of the risk. You knew by sitting as close to the field as you were that you could get hit by a foul ball or a bat. The same would be true here. You would have a specific, you know, assumption of the risk and waiver on the back of the ticket. And quite honestly, maybe the best process would be to go to all electronic tickets and do the same thing we talked about with, you know, confirming you received the PPE and checking a box. Anybody buys a ticket to a college football game, there's a COVID assumption of the risk and waiver language in the purchase, and you click the box, and then you have a paper trail of the person having read, acknowledged reading, and acknowledged being bound by the waiver and the assumption of risk. But again, even with those in place, you're most likely going to get sued by somebody down the road.
Right. It's just preparing yourselves to try to give the best possible defense in this situation.
Well, correct. And schools, you know, we talked about my background as an insurance recovery lawyer, and that means basically my entire career I've been focusing on representing companies and higher education institutions and any policyholder when they have a claim, when they get sued. So if you get sued, the policy that most likely triggers is something called a general liability policy. It's a policy that protects against third-party liability. So let's say a fan attends a game, they say they contract COVID-19 and that the university didn't properly wash down the seats or disinfect the stadium, or, you know, some allegation that they breached their duty of care. In addition to the waiver and the assumption of risk language on the back of any ticket or in an electronic ticket form, schools also should have general liability insurance that should be triggered when they're sued for negligence, breach of the duty of due care, you know, something along those lines. And hopefully, if trigger coverage is triggered under a policy like that, then the insurance company would pay the defense of the college or university against the lawsuit. And if you followed all your protocols and guidelines, then you may not have much liability exposure. So colleges and universities may be pretty much fully covered for any potential lawsuits, both defense costs and indemnity or settlement issues.
Yeah, and that's important. It's important for people who want to become college presidents to understand what liability and risk management is, and also people who report to college presidents, and that's part of the target audience for this particular podcast. Let's shift to the employee situation. Let's shift to the employee who doesn't have a multiple year contract like a football coach, but maybe they're just on 1 year contracts, or they're even part-time. What do universities need to do to protect those coaches who have pre-existing conditions and are worried about exposure to COVID if it's not in the contract?
Well, my assumption is most of the contracts, whether it's 1 year or multi-year, have no provisions regarding communicable diseases.
Yeah.
I haven't reviewed many of the contracts, but I can't imagine anybody had the foresight to put that in. So, with respect to doing what's right for an older coach who has pre-existing conditions, or even a younger coach with pre-existing conditions, again, what should be at the forefront of everybody's mind is the health and safety of the employees, the athletes, the students. And if you keep that in the forefront, you should be and approach it that way rather than approaching it as a financial issue. That will go a long ways towards minimizing your liability. But one thing I mentioned, a head coach could potentially sit in the press box or in a suite somewhere and have headsets down to the field, and talk to players and coaches that way. And you may be able to isolate that with plexiglass, partitions and trying to keep distancing. And if a coach doesn't feel comfortable with that, coming up with an idea on protecting a full face mask, not football face mask, but a face shield,
Right.
And employing some of the procedures that hospitals have been using since COVID broke out. So gloves, long sleeve shirts, however you need to do it so that you can minimize the risks.
Yeah.
Again, I don't think you're going to eliminate the risk, but you can do a great job in minimizing it.
I think one of the things that I've learned a lot about this is that we have to recognize each other's humanity, and that some people may not look sick, but they have an underlying condition and they need to be protected. And that's what's sometimes hard for athletes, is that if you don't have a broken leg, you're ready to go. You should be ready to run right back in there. And in college sports, we have to realize that people do have things like type 1 diabetes, or they were born with a heart defect, or any kind of number of things that just aren't seen. So recognizing that humanity in other people, I think, is important.
Well, it's very important. And to say that, these are Division I or at least college athletes, and they're in great shape, and they tend to be, 18 to 22-year-old kids, and they should be at the lowest, exposure risk of anybody in the country for COVID-19. That doesn't mean that they're not still at risk somehow.
Right.
Have kids playing with not just diabetes, but there may be kids with asthma that are playing, and any immune system deficiency, should be disclosed to the team doctor and the medical staff and the training staff, and special precautions should be made. And again, just recognizing that just because they're 20 years old and in great shape doesn't mean they're not going to get COVID.
Right. Exactly. So let's go through the unfortunate situation of a player being withheld from a practice or a game, and the media is aware of it because they contracted COVID-19. What do you say? What are the athletes' rights, and then what is a school allowed to say?
So I've heard a lot of people talk about HIPAA, which is the Medical Privacy Act, basically. Right. But that usually only applies to medical providers, hospitals, doctors. So I don't think HIPAA is the concern for colleges and universities, unless a doctor's speaking and medical advice is being given. But the Americans with Disabilities Act also has medical information privacy aspects to it. So complying with the ADA is important. Understanding what the ADA says and what your obligations are is important. This goes back to the risk management and safety and occupational safety and hazards. The school should have, experts in those fields analyzing and discussing it with them. For the most part, if a player's out, they should just be said the player's out, and not identify COVID at all. Internally, how do you talk to other players about it? You may just say, we have an issue with someone who's contracted COVID-19 without identifying them particularly. There's going to have to be some self-quarantine, and players may, in some ways, although this is a bit of a stretch on the analogy, I suppose, but it's the same with concussions. Football player gets hit on the field, comes to the sideline, tells the coach he's fine, right?
Always.
If they, because I want to get back in the game.
Right.
If a student athlete has a temperature and says, no, it's just a flu, it's nothing big. I get colds all the time, or I'm sneezing. There's going to have to be extra precaution taken, and student athletes are going to have to understand that schools have an obligation to protect everybody, all the other athletes, referees,
right.
Training staff, everybody needs to be protected, and they're going to probably overreact, but that's probably a good thing in this situation.
Yeah, absolutely. Again, it has to be thinking of the community, not just the individual person in this situation.
Well, and the community, as you pointed out, the student body as well, because, one of the issues that comes up in college athletics is the travel.
Yes.
So are you going to be taking planes? Are you going to be taking commercial airlines? Or, what are you going to do to protect them in those settings? Having enough PPE is going to be important. Having, the proper type of personal protective equipment and gloves, teaching the student athletes, some people wear gloves and they have they have a sense of security that's unfounded because they're touching too many things, and then they touch your face.
Right.
So instruction and assistance and trying to explain how to properly wear a mask, when you should be wearing a mask, how and when you should be wearing gloves, and what you're supposed to be doing with those as well. So, it probably isn't a bad thing if colleges, universities retain a virologist who can assist with, explaining how it all works, and doing a training session in fall practice, and going from school to school and doing the same thing.
Yeah. Behavior modification is one of the hardest things to do for athletes who are used to getting into just doing things by feel and by nature. So that really forces them to think differently, I think.
Well, I think you're right there. And that's just going to be something that has to be taught and reinforced as on a regular basis. Constantly. And there are going to be kids who just disregard it all.
Yeah, absolutely. And that would be really unfortunate. Just a couple more questions. Do pandemic insurance policies exist today? Are they there now? Do we even want to look at them?
Well, so let's start with the background. There's nothing really called a pandemic insurance policy. Okay. I know it's been in the press but that type of policy doesn't really exist. There was event cancellation insurance, which you could take out for a specific event like the Wimbledon tennis tournament or the British Open or March Madness. And before January 24th of this year, you could purchase for about 15 to 20% additional premium coverage for communicable disease exposures. And so, like Wimbledon did that. In 2003, when the SARS epidemic first hit, Wimbledon made the decision that they were going to buy the additional communicable disease extension of coverage on their event cancellation policy. And they have done that for the last 17 years. They paid about $34 million in premiums for that policy with that extended coverage. But now they're looking at getting $150 to $300 million payout under that policy.
Wow.
Because they had the foresight to do it.
Right.
The British Open had it, March Madness, the NCAA had event cancellation, and I believe it had pandemic or communicable disease coverage on it. Their limits weren't high enough. They should have been higher, but that's another story for another podcast, I suppose.
Yeah.
But after January 24th of 2020, you couldn't buy that extended coverage. There were a lot of business interruption policies that included coverage for communicable disease as well. And there were a lot of businesses, leagues, and companies across the world that have that as part of it. But when they're renewed this year, that coverage is probably not going to exist any longer.
Right.
Maybe a couple of years from now, and you may be able to buy it, and it's probably something that a risk assessment should be undertaken to determine whether the premium's worth it. But No, you can't buy communicable disease coverage right now.
Yeah, well, that kind of makes sense at this point. My last question, are all the people who come to your facility to work a game or an event? You know, people like referees, people like statisticians, even television production folks. What's the university's responsibility for keeping those folks safe?
Well, you asked about employees earlier, and one of the important aspects of this is if you contract COVID in the workplace, you're going to have workers' compensation exclusivity. So
Right,
you may not be able to sue the college or university unless there's gross or willful negligence.
right,
Um, so that might apply to the production companies and television people. They're employed by the TV companies, and as long as the stadium and the arenas are properly cleaned and disinfected, again, you should be immune from the liability. That doesn't make you immunized from lawsuits. Um, but they're treated the same way. You know, the people who are dealing with the yard marker signs, those probably need to be cleaned on a regular basis during the game, before and after the games. You know, there's all sorts of things, the kicking tee, you know, there's all sorts of things people aren't thinking about, but
right.
everything needs to be disinfected. Um, Somebody once in one webinar I attended was talking about, you know, hospital level disinfecting. That should probably apply in the college and university setting, and then the stadiums and arenas. And
Yeah,
you've got the workrooms and weight rooms and
right,
workout facilities, and every ball's got to be cleaned. And, you know, it's
yeah,
going to be important, but I think keeping a log of cleaning things is going to be important as well. So the people who are in charge of football should have a log, you know, clean this time, clean that time. And maybe there's, you know, an app on a phone that makes it easier to keep track of it rather than walking over to a sign-in sheet or something. But
right, right,
technology is going to come into play in all of this as well.
right. And those who are independent contractors, like referees, are oftentimes independent contractors in the college level. What protections do they have? Do they have any?
Sure, that's the same thing. You know, maybe conferences decide that referees have to wear a face mask as well, or a
Okay,
face shield, and maybe they have to wear gloves.
okay,
So as long as they comply with the, you know, guidelines and procedures, you know, you're going to have the same situation as with the student athlete.
yeah. Well, Richard, thank you. That's really great. Is there anything else that you think college senior leaders need to know in this situation that they should be thinking about?
Well, in addition to your risk assessment and risk management people, and your health people, I think talking to lawyers before these guidelines are issued and implemented, and trying to have, you know, the legal implications, the health implications, and the risk management implications all wrapped up into, you know, a process is probably very important.
Makes sense.
Because again, you know, a lawyer isn't going to know all the health concerns, but he or she's going to know, you know, your liability issues.
Right. Exactly. Exactly. Well, Richard, I want to thank you so much for joining my podcast and giving us a huge education in all of the hurdles that we've got to clear in order to safely put athletes and teams back on the field. So thank you.
Well, thanks for having me again, Karen. And the hurdles aren't insurmountable. So
Yep.
I,
It just takes
that's good
attention to
news.
detail. That sounds like what you're saying.
Exactly right.
Yep. That sounds great. All right.